Please also understand that there are some openings in the diaphragm. These openings are referred to as, some are major and some are minor. So you need to concentrate more on the major opening. So what are these major openings? Okay. First and foremost, in the central tendon, I said there is an opening in the center. This opening is for the inferior vena cava. Okay, this is for the opening of what? Inferior vena cava. So in the central tendon, you have the inferior vena cava, and this inferior vena cava usually, yes, passes through this opening. Okay, so the first major opening is that of the inferior vena cava, and this is at the level of T8 and T9. Okay, T8 and T9. Next is some fibers. Okay, some fibers of the right crus, they pass obliquely. Okay, they pass obliquely towards the left. Okay, spiral around another opening. Okay, spiral around another opening. This is the opening of, okay, this is the opening of the esophagus. Okay, this is the opening around it. So which fibers are taking? The vertebral fibers are taking a spiral course and encircling the esophagus. So the second major opening is the esophageal opening. Okay, so as said, esophageal opening is more towards, yes, it is more towards the left side, and this is at the level of T10. Okay, this is at the level of the T10. Most fibers of your right crus, okay, most fibers of your right crus orient there. Last but not the least, the major opening between the right crus and the left crus is for the aorta. Okay, the descending or the descending thoracic aorta becomes abdominal through this, between the two crus of the diaphragm, which is bounded above by the, yes, okay. So the aortic opening is bounded above by the median ligament, on the right side by the right crus, left side by the left crus, and posteriorly by the vertebra. Okay, this aortic opening, important major opening, that is aortic opening, is at the level of T12. Okay, so please remember the order, it will be easy, 9, 10, 11, so sorry, 9, 10 and 12. Okay, so at the level of T8 and 9, you have inferior vena cava, at the level of 10, you have opening of the esophagus, and at the level of T12, you have the aortic opening. These are the major openings. Some of the minor openings, okay, to understand it, some of the minor openings you need to understand or appreciate it is at the sternal origins, okay, at the sternal origins, there are minute openings for the passage of superior epigastric arteries. Okay, minor openings for the passage of superior epigastric arteries. Okay, if you remember, the superior epigastric artery is one of the important, okay, one of the terminal branch of the internal mammary or internal thoracic artery, which has to reach the rectus sheath to anastomose with the inferior epigastric artery. So one of it is the superior epigastric artery. Between, okay, between the costal origins, okay, between the costal origins, usually the costal origins of the muscle fibers of diaphragm interdigitate with the costal origins of the transverse abdominis. So even your abdominal muscles also take their origin, especially the transverse abdominis takes origin from your lower 6 costal or lower 6 ribs. Okay, so there will be interdigitation between the fibers of diaphragm and the transverse. So there are minute spaces between them. These minute spaces between them usually allow, okay, usually allow the lower 6 thoracic spinal nerves. Okay, so lower 6 thoracic spinal nerve. So next minor openings are for the lower 6 thoracic. Okay, so I am mentioning it T, thoracic spinal nerves. Spinal nerves. So these are some of the important, okay, so these are some of the important minor, okay, minor openings. Please remember the major: inferior vena cava, esophagus, esophageal opening, and aortic, and the minor ones are for the superior epigastric, which is prominent in then the lower 6 spinal nerves. Now not only that, in relation to medial and lateral arcuate ligament, medial and lateral arcuate, just beneath the medial ligament, medial arcuate ligament, you have subcostal nerves and vessels arising. Okay, medial costal, you have the subcostal, okay, you have the subcostal vessels arising. So these are all minute opening. So just remember, the two most important are these, you need to understand them. Okay, so these are the major and minor openings in the diaphragm. So a small note on how diaphragm is going to help in inspiration.